Good Wednesday afternoon. I'm Charity Menefee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude is to those who are making responsible and thoughtful weekend plans ahead of the July 4th holiday this Saturday. This is often an exciting time of the summer filled with travel and large gatherings, and we know that celebrations may look a little different this year, but we are grateful to those in our community who are planning to celebrate while also prioritizing the 5 core actions to ensure the safety of those around them. As a reminder, the Board of Health will meet tonight at 5 p.m., which is why we are updating weekly benchmarks today. When the board determines a regular schedule for their meetings, we will align our weekly benchmark updates with the day they designate. First, we will begin with the local situation. We have 977 confirmed cases of COVID-19 in Knox County. Additionally, we have 29 probable cases. 701 of our cases have recovered, giving us 271 active cases. 78 individuals have been hospitalized at some point in their illness, and 13 Knox County residents are currently hospitalized. We are thankful that we have no additional deaths due to complications from COVID-19. And now we'll transition to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. Every day we look back at the previous 2 weeks. That's what a rolling average is. Overall, what we mean by this is we are trying to see, are things getting better, staying the same, or are they getting worse? And if so, how much better or worse, and at what rate? Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. We have seen several consecutive days of red flags and a significant continuous increase in new cases. This causes us to represent this traffic light as red. This is a concerning trend and further reiterates that this virus is still very much present in Knox County and the critical importance of following the 5 core actions. These actions alone won't completely eradicate COVID-19 from our community, but they will help significantly slow the spread. Our second benchmark, community-wide sustained and increased diagnostic testing with a consistent or decreased test result reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs, one that shows a sample of the test conducted for Knox County residents and another for the average time between specimen collection and lab report data. For the first graph, we did detect red flags, but they were not on consecutive days. Anecdotally, though, what we are hearing from hospitals and private providers, including our own testing at KCHD, is that the testing looks to be in good shape and consistent with previous weeks. For the second graph, we want to see this number stabilize or decrease. That means we want to see the lab results come in at the same pace or more quickly. This week, the time it takes to receive results from the lab has stabilized and is not increasing in the same manner we were seeing in previous weeks. As a quick note, because this time frame is low to begin with, even a small increase could register as statistically significant. That said, because what we are seeing on both graphs this week, the benchmark is represented as yellow. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to reach out to cases within 24 hours and close contacts within 48 hours. To date, throughout this pandemic, we have accomplished that for all of our cases and contacts. Because of that, this benchmark continues to be represented as green. As a quick note, we are bringing in and training more individuals to assist our epidemiology support team and build out our local contact tracing capacity beyond our internal team to be able to help respond to the growing caseload. While you will see 70 team members listed in today's information, it's important to note that not all of them are working every day, all day, every day. Since this team's work is required 7 days a week, this increase in response team members allows our staff to even out their staffing responsibilities throughout the week. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospitals. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, the East Region, or patients from other jurisdictions. For this benchmark, the traffic light remains green. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all of the data into consideration. It is important to note we did experience days of statistically significant increases regarding positive patients, ICU patients, and ventilated patients. However, after speaking with our hospital partners, they stated their benchmark should be represented as green because they are still well within their capacity to safely respond to meet the needs of COVID positive as well as non-COVID patients in their hospitals. The hospital systems continue to meet weekly, assess the situation, and plan their response together. They are watching the situation very closely and communicating with us regularly. Nevertheless, we do want to note that hospital numbers are continuing to trend up. This is very important for people to understand. While the hospitals remain within their capacity to respond, this trend again demonstrates that the virus is still very present in our community and putting more people in the hospital, which is yet another reason we continue to strongly recommend and highly encourage the 5 core actions to reduce the spread of this disease. And our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we show the chart that details cases, hospitalizations, and deaths. This benchmark remains green because we thankfully have not had an increase in deaths. And now we'll open it up for questions.
All right, as a reminder, please type your questions into the chat feature and please put in your name, your full name, as well as the media outlet in which you're affiliated with. From Cole with WBIR, can you walk us through how the data snafu happened today with total cases?
Yes, so we moved our benchmark day to today instead of Friday, and that data was pulled first thing this morning since it's a bigger data load. And then our case numbers were pulled after that, and there were cases that came in between those 2 time periods. So we had to go back and update the benchmark data to relate or to have the most current data information that was available. That's all that was simple, just needing to go back and update the first data run that we did this morning.
From Megan with WBLT, has the Knox County Health Department received any information regarding the new strain of swine flu currently spreading in China that is causing alarm regarding potential for a new pandemic?
Not anything specific other than what you've seen in the media at this time, but we will be keeping a close eye on that as things develop.
From Madison with WATE, more than double the number of cases from the end of May to today. Do you think this is a reflection of how our neighbors, the community, are handling this virus?
I think it very likely can be. And that's why we talk about the same things all the time of all of the things that we can do to reduce the spread of this disease within our community. There are easy things and everybody's empowered to do them, and we ask them to do them. So wearing a mask when you're in public, not going out if you're sick or you've been told to stay home, washing your hands frequently disinfecting services, and also making sure you're trying to keep that physical distance of at least 6 feet between you and others does so much of a good job in protecting us and limiting the spread of this disease. And we need that to be happening more so we can start to see this curve back down more than it has been lately.
Also from Madison with WATE, what is the conversation between the health department and the Knox County School District look like? What advice are you giving leaders, and do you think it's feasible to have in-person classes this fall?
We talk with the schools all the time, typically multiple times a week. We're setting up routine calls that we'll be having with them moving forward. And it's really a dialogue back and forth. We are advisors to the school. Ultimately, the superintendent and the Board of Health is who sets Board of Education, sorry about that. The Board of Education is who sets school policy, but they talk to us and they get our advice, and we provide that to them regularly.
From Cole with WBIR, roughly what percentage of the probable cases end up being confirmed cases?
I'd have to go back and look at the data on that. Not all of them end up going and getting tested. And that's up to the individual to choose whether or not they do so. So I don't have that exact number, but probably a pretty large portion, but we'll have to go back and look at it.
From Alan Sims with Inside of Knoxville, hearing claims that a second test for a person who has already been included in the count is being considered an additional positive for reporting. Is that true?
That is not true. So, and that's part of the difference when in deduplicating data as it comes in. So an individual who's been positive is only counted as positive in our counts once, and that's it.
From Vincent with Sentinel, I'm curious about the second benchmark. Last week, there was a substantial decline in testing turnaround time. This past weekend, there were errors in the reporting system. How does that square with this stabilization you're reporting?
Well, and that's why we've put it at yellow, because there were issues with the reporting turnaround time last week and into this weekend. The guidance that we got from the State Department of Health on our call on Monday with them was that there had been a fix put into the NBS system, a patch as they called it, to help expedite the importing of results into the system. And we're waiting through this week to see what that looks like as they're catching up on the backlog of new cases and old cases coming in, to really see what the true impact is and where our timeframes will lie after this week. So that's really part of the reason we went with a yellow today. Is we're cautiously optimistic, but really want to see the full data after this week.
From Madison with WATE, can we get an update on the number of complaints of businesses not complying?
Since May 1st, we've had 178 non-food complaints and 250 food complaints.
From Cole with WBIR, can you walk us through your 4th of July advice?
Really, it's going back to, and it's going to be hard, those 5 core actions. And so making sure you're not in large crowds, that you are keeping distance and staying within your family unit when you are with other people as much as possible, that you're wearing a mask. Everybody should be wearing masks in these situations when they're going out together, that you are frequently disinfecting surfaces, that you're washing your hands. And if you've been asked to stay home or you're not feeling well, that you do not go out and celebrate with others, that you stay home during this weekend.
Also, Cole with WBIR, the hospitalization benchmark is for our East region. Is that the region as defined by TDH?
Yes, so it's East region and Knox County. So Tennessee Department of Health regions have metros and then regions that have multiple rural counties typically in them. So the East region are all the 15 counties that surround us, and then we're the metro region, Knox County. So when we're talking about the Knox and East region combined for TDH, which is actually the Knox East Tennessee Healthcare Coalition's region. So they all blend, but it's us in the 15 counties, yes.
And then Cole is wanting a list of hospitals included in that region, and how many are there?
There are 19 hospitals in that region. So all the hospitals in Knox County, and then all the hospitals in the 15 surrounding counties. And we can put that, I believe we're going to send that out and put it on the website today.
Yes, we can do that today.
So you'll get those today.
From Scott Barker with Compass, will the health department make a recommendation to the Board of Health regarding a possible mandate to wear masks in public as Memphis has done? And if so, what will that recommendation be?
So we're going to be having a conversation. I'm not on the Board of Health, but they'll be having a conversation today about all of the different 5 core actions and how there can be impacts made to help encourage people to utilize them more. And those discussions will be had tonight with the Board of Health, and recommendations will be made there.
Scott's follow-up question is, will the health department make any recommendation on other topics to the Board of Health?
I think that's all to be seen tonight. Again, I'm not on the board, and Dr. Buchanan will be representing us there tonight.
From Madison with WATE, is there anything different about enforcement or education now that we're under the Tennessee Pledge?
There's not. It's really back to the education piece. That's the primary thing for both the Tennessee Pledge and under our guidance that we had received as our primary role for businesses. And then we still have, if we do have cases affiliated with businesses, all of the things that we can do once we have a case, if extra actions needed at that time.
From Megan with WBLT, drug maker Gilead recently announced the cost of remdesivir would be upwards of $2,000. Will there be any assistance available for uninsured Knox County residents who may want to be treated with the drug in the event they test positive for COVID-19?
I saw the news report as well, and we haven't received any specific guidance on any of those type of assistance programs. They typically exist, but I think more information will need to come on that. We don't have any specific info at this time.
From Cole with WBIR, do you keep an eye on other nearby counties' data, and what do you look for?
We always are looking at what's happening around us. And again, we have regular calls with the state where we can hear about those. And it's really just having situational awareness. This virus does not know borders and county bounds or any of those things. And so just keeping an idea of what's happening. So knowing where hotspots are around us and all of those things. But I think the big message right now is that wherever you are, COVID's a risk to you, and that we all need to be taking the same precautions to protect each other and protect ourselves.
From Madison with WATE, now that we've adopted the Tennessee Pledge, given the situation across the rest of the state, can the Tennessee Pledge be modified to provide additional protection to Knox County?
Yeah, I think that's something the Board of Health will be discussing on how we move forward with that this evening.
From Brian Hornback, the distance between individuals have always been 6 feet. Are you staying within 6 feet in your conversations with Knox County schools? So 6 feet between desks in the classroom, 6 feet between lunchroom, sitting area, et cetera.
I mean, I think that's the guidance, and in general, maintaining 6 feet, but there's also things that you can do, wearing masks and all those things when you can't. And so there's the discussions that are being had of what's feasible in classrooms and in schools to try to do the best that they can do to protect the students and the staff and everybody that's there. That's definitely up for discussion on how challenging it would be that they're looking at different ways of implementing the guidance.
From Madison with WATE, regarding Knox County schools, do you think it's feasible to have in-person classes this fall?
That's, I think, a discussion that still is ongoing, and we're going to continue looking at what the situation is as it gets closer to the school year, and ultimately we'll make recommendations to the schools, and they'll implement their plans based on what they see is best for the schools and the students and the staff there. So you can ask the schools as well.
From Cole with WBIR, would making mask use mandatory reduce the spread of the virus?
You know, I think that's a difficult question. I think that we know that wearing a mask reduces the transmission of the virus. And so we encourage that. And we're not going to stop encouraging that. I think that's the most important thing there, as well as the social distancing and all of the other things that go along with it. It's most important that people do wear the mask, whether it's mandated or not. I think there's debate there, and that'll be discussed by other groups moving forward.
From Claire with WUOT, now that we're under the Tennessee Pledge, is it accurate that public-facing businesses are no longer mandated to require employees to wear masks? And are you concerned that businesses might choose not to enforce employee mask use?
Yeah, you'll have to look at the pledge. I think that it says should a lot of times and those types of things. I'm getting nods on that. Again, the 5 core actions still apply. And I know I'm beating a dead horse, but we want to encourage everybody to do that. If you have questions or concerns about businesses, you can still always call 311 and lodge a complaint or get your questions answered that way. We just ask that everybody do the right thing and follow all the businesses, and follow the recommendations as they exist.
From Cole with WBIR, you mentioned bringing in more people to the epidemiology team.
Mm-hmm.
Are these furloughed workers from elsewhere in the county or other KCHD employees in various areas?
It varies right now. So we have some additional KCHD employees that we've pulled in from other areas. We have brought in some folks from the libraries are helping us. We've had some of our Medical Reserve Corps volunteers that have started helping us. And we are bringing back some furloughed Knox County Health Department employees coming back on the 6th, Monday. Thank you. And so they will be added to the team as well.
From Claire with WUOT, from your contact tracing calls, what percentage of cases would you estimate were regularly wearing a mask in public before contracting COVID?
Oh, that's a good question. I know we hear frequently that folks have not been always or not consistently doing them. Some people are intermittently, but I don't have a hard number on that. But I do think that with the amount of new cases we're seeing and from what we're hearing from people, that there are a lot of folks that aren't. And it's not just the mask wearing, it's all of the 5 core actions. So it's that social distancing piece that plays a role there as well. It's getting in large groups with different people. All of those things are playing a role as we're seeing our cases grow more rapidly than we would like.
From Vincent with the Sentinel, how does KCHD account for interstate travelers and their COVID-19 contact tracing efforts? Do you call potential contacts only within Knox County, or do you contact trace farther out?
We contact trace farther out. We're not actually doing it ourselves. What we do is we notify the Department of Health when we'll talk about in-state and out-of-state. We notify the Department of Health that we have out-of-state contacts, if they're close contacts in a different county or a different state, and then the Department of Health will contact that jurisdiction. So it'll either go directly to the other county here. Oftentimes when it's an East Region county, we go directly to the East Region because we work so closely with them, and we just share information directly with them. But other counties, in West Tennessee or other parts of the state will go up to central office, and then they will dole it out. Or they'll go to the state of the other folks that are needed, and then their state health department will get it to the appropriate people to get those people traced.
From Megan with WBLT, a WBLT viewer has questions about best practices for travel. What advice do you have for anyone considering travel over the holiday weekend?
Again, I know I am repeating myself here, but it goes back to those 5 core actions and really making sure that you're following those to the best of your ability. So if you're traveling, if you're flying, making sure you're wearing a mask, that you're washing your hands frequently. All of those things are very important when you're driving, making sure you're doing it. If you're stopping to get gas and you're going to pump the gas and you're going into the store, still following those 5 core actions are so important no matter where you are, because there is risk everywhere that you can go at this time in our country. And so just really encouraging people to continue to do those. I would also say try to stay within your family groups as much as possible and not interact in large groups where you can stay separated. We call it cohorting. So stay with your family group as much as you can as well.
Any other questions? Please go ahead and submit them now. All right, not seeing any other questions come in, so thank you all for joining us. We appreciate it. And as a reminder, we will not be having a media briefing this Friday due to the holiday weekend, so we will resume those media briefings on Monday of next week. Thank you, and have a happy and safe holiday weekend.